Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. We got an awesome show for you today. First off, we're going to talk about the most dangerous surgeries out there. Next, people that are dying to be disabled. And finally, Sarah's going to get us up to speed on summer fashions, and it's coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for joining us. We really do appreciate it. Please leave us a like and a comment, and let us know what you want us to talk about on the next episode. I'm your host, plastic surgeon Dr. Bruce Hermann. With me always is the great Sarah.
Hi.
What's up, Sarah? In the box is Travis. How are you, buddy?
Hey, what's happening? What's going on?
Not much. Everybody having a good week?
Yeah.
Friday, as
cool.
always. Love being here.
Yes.
It's Friday. Can't
Yeah.
complain about that.
Exactly. Week's going good.
Yeah. So I have to ask you guys, were you following this whole submarine thing, the Titanic deal at all?
For sure. 100%.
I guess everybody
Maybe,
was, right?
Maybe just a tad.
Man, I was so enthralled with it. I was really kind of nervous about what may have happened to them from the beginning. I mean, not that I'm an ocean expert, but I know the ocean's very dangerous. And
Yeah,
it seems
that's like they were going, to me, it's like going
out into
in
space
that,
or something.
I was
right?
like, you're going into space and you're going to ride this little moped looking
a moped, yeah.
submarine. I'm
Dude,
like,
I have to say, what really kind of
no,
brought
sir.
What it brought home for me is someone posted a picture of the submarine that, James Cameron, the director of Titanic, the movie, someone posted a picture of his submarine and the inside of it versus the submarine that they were in, and it was just night and day difference. James Cameron's sub looked like something that NASA built.
Exactly. They went in a spaceship.
Yeah, right. I mean, it was amazing. And then the one that they
Yeah.
went into, it was just a hollowed out tube. There wasn't even seats in it.
Yeah.
Yeah, that was pretty. I mean, it's really sad. I mean,
Well, didn't the whole, I guess the ending of it is they died, but they didn't suffer.
No, probably not. Yeah.
Yeah,
I mean,
that's what I was concerned about, is that they're just sitting there.
sitting on the bottom of the ocean
Yeah,
for 5
sitting
days.
there waiting to get rescued and
It not happening.
yeah, and just dying at
Yeah.
the bottom of the ocean.
I was reading something about when subs implode. I mean, apparently it's just instantaneous.
Yeah, I saw they made a little. They've already put it on I don't know where I saw it. I mean, it was I follow BBC News.
BBC.
Yeah.
Yeah.
And I think I don't know if it was them or not, but I saw a
Infographic or something.
yeah, a little video, it was graphic, a graphic thing,
Yeah.
and it just showed how it would implode.
Yeah, they were saying that
As it got lower.
at those deep depths, that a sub will implode in 10 milliseconds, and your body.
It just disintegrated.
Yeah, it just
pretty much.
disintegrates. And something how the air, when it gets that sudden compression, it's almost like an explosion.
Flammable.
Yeah, flammable, like a fire explosion.
Yeah.
They were just incinerated instantly. Well, I guess
Wow.
that's better than
Suffocating to death.
suffocating to death. Yeah, but it's still sad.
Well, yeah,
I don't
it's
know.
all really sad, but it's I would never have signed up to do
Yeah,
that.
I mean, I'm all for doing crazy stuff, and I've in my life have wanted to do things. Oh, I have done a little bit of mountain climbing and random things that are not necessarily safe, but I don't know. Looking at that sub, I would have been a little
Yeah, it looked
questionable.
sketch.
Even though I guess it went down several times with no problem.
Yeah.
Prior to that.
But I feel if you're gonna pay, especially if it was for tourists or whatever, that's what they made it for. It's
Gotta be a little bit more high quality.
yeah, if you're gonna, they said it would cost $250,000 for one ticket. Is that what they said?
Yeah. So it's about $1 million per ride.
Yeah, I
that
better
they're-
have my own private room.
on the
to
submarine.
watch to see Titanic, that's what I would want. That's so much money.
I wonder how much the sub cost that James Cameron used versus the sub that
Yeah,
they
and
were
he's
using.
not an adventurer.
I mean, but he's pretty rich. I mean,
I know, but those people, I guess because they were they go on these adventures, they probably go on sketchy stuff all the time.
Yeah, maybe.
Apparently.
I don't know.
Some of them were
I don't know. The sub to me, look, they controlled it with like a
Like an
Xbox or
Xbox controller.
PlayStation controller.
Yeah, I saw that.
That seems a little.
Well, obviously they thought it was safe because the CEO went down there.
Well, yeah. Yeah, apparently you've been down there a lot. I don't know, Travis, would you get in that sub?
No, I would not. I don't know how to swim, so I already don't like water. And then to be fully submerged underwater without an escape, nah, I wouldn't.
That's a hard
do it.
no for you?
Yeah, it's a tough no. It's an easy no, though.
Easy no?
I don't like the blackness of
Right, it seems very
of
just
the ocean. Like that
dismal
point
down there.
that point wherever it like just becomes like
The midnight zone or something.
Well, I remember I went like, to the Caribbean and did like snorkeling and stuff. And it was almost like there's like these underwater cliffs you know, that just like drop off into the abyss. And like I had gone and
you look down, it's just pitch black. And you're like,
and
I'm not going down there.
And like this guy, he was in the Marines, I guess. And I knew that because he's one of my friends. But like he was like swimming down to the very bottom, like, where all the pretty coral and all the fish are. But he like swam all the way down. Like it looked like he was going to go like peek his head over. And I was like, oh my God.
So I've actually been in a submarine.
I was like, I can't watch this.
When we went on family vacation, it was I think a couple or 3 years ago. We went to Hawaii, and they had a submarine tour of around the island. And we're like, okay, we looked it up. It all seemed pretty legit. And I was just thinking how that sub looked compared to the one that they were in. The submarine that we were in looked like a submarine like the Navy might have. Like, you go down the thing and there was like
I wonder if it was probably like a decommissioned one that they just were like, oh,
we have
it
a
wasn't
better
that model.
It was pretty small. Like it was probably as big as like I don't know, like a Winnebago. It was bigger than a car. But it had a cockpit with two people, and it looked like the inside of maybe like an airplane or something. And then there was all the back part, where the people would sit. And I was thinking, well, okay, this looks pretty legitimate. It doesn't look like somebody built this in their workshop over the weekend or something.
They actually have like submarine hotels. Like you can actually
like a cruise ship.
Like it moves,
submarines?
or it's just an underwater building?
No, I think it's stationary.
Oh, okay.
Yeah.
I don't know if I've seen that.
So it's an actual submarine that they converted into like a hotel room, basically.
Really?
Yeah, and you can rent out the hotel room submarine. They deliver pizza to you, and then you just stay there for the night or however long.
How do you get into it? Is there a tube or?
I think you climb on top of it basically, and then you go down the ladder, kind of like a regular submarine, pretty much. And like you can stay in it for like nights on end.
Really?
It's like $400 a night. I think it's pretty expensive.
Is that like in the Caribbean or?
No, it's here in the States. I just don't know where. Yeah, they actually have these.
That's interesting.
Yeah, a friend of mine was saying that they were looking into doing them at one point, but then they didn't like how tight the space was.
Well, yeah, submarines are pretty cramped.
Yeah, right.
Normally.
Exactly. So they
Sorry,
changed their
Sarah,
mind.
you're not going to get like the presidential suite in a submarine.
I'm small, so I
like
guess
a
I'll
bunk.
fit in
No,
anyway.
facts. It probably would be more than enough room.
Well, it was very interesting, the whole thing, and obviously very tragic. But it was
Absolutely.
it was very interesting how like the whole world was just kind of on edge about what happened to this submarine. I guess everyone loves the Titanic story, or not loves, but is interested in.
I saw a bunch of like memes about it.
Oh, dude, nothing can happen.
About Titanic, like ghosts just like sitting there chilling and then like
the
seeing
submarine
some
stuff.
kind of like beep.
Yeah, I don't think anything can happen these days without memes being popped up.
Yeah,
I think
know. I'm like, oh, that was kind of funny, but also
Very
it's too soon.
Morbid. Yeah, it's too soon.
The unknownness of like the ocean, I think that's why like people were so like captivated by it too. They just were like, did he fake it, or is he still alive? Did they explode? Are they suffocating down there? Is it lost? I think just the unknownness of all of it, it just had everybody on edge.
Yeah, totally. Well, sad story. I wish they could have found. It would have been a really, really cool story if maybe it got caught up and then they rescued them.
Did you see the other stories that were like there has been situations where like they rescued people in those types of situations?
No, I hadn't seen that, but I'm gonna look it up now.
There was an interview with like a
that somebody had done it.
Yeah, like I don't know, like an ex Marine person. I don't know.
Navy SEAL or something.
Yeah, that was on one of those types of vessels and was rescued.
Well.
Yeah, so it's like it's happened before.
Yeah. So unfortunately this time, not so much.
Something must have horribly happened for it to,
I wonder if they'll ever figure out exactly what happened.
I don't know.
I think they will. I think they are really good at piecing together like stories of what happened when it comes to like those type of situations.
Yeah. Well, it'll be interesting to see. I'm sure there'll be more stuff about it.
Absolutely.
Coming up.
100%.
All right, well, talking about dangerous things, I'm going to move on to my first topic. We always talk about surgeries and, what surgeries are dangerous, more in plastic surgery. But I thought it'd be interesting because I don't think we've ever talked about what are the most dangerous surgeries out there, And interestingly enough, I've done a lot of these just because my background before plastics was general and trauma surgery. And so a lot of these actually have some personal experience with. So as we've talked about in the past, overall surgery is very safe. If you look at all surgeries that are being done, so this would include things like I do, such as elective plastic surgery, up to things like heart transplants or even trauma surgeries where people are shot or in bad car wrecks. If you take all surgeries across the board, your overall risk of dying is 0.5%. So that's 1 out of 200. That sounds kind of scary whenever you see that number, but you do have to realize that there are a lot of people who go into surgery with life-threatening emergencies, and realistically, they're probably not going to make it through the surgery. So that does skew it. So some of the factors that affect what the mortality rate for a surgery will be, there's some obvious things like patient age. Younger people tend to do a little bit better with surgery. Overall health, if you're overall very healthy, in great shape, you're going to have a better chance of coming through than somebody who has 10 chronic diseases. Whether or not the surgery is elective, emergent, or traumatic, those make a huge difference. Trauma surgeries are going to have some of the highest mortality rates, followed by emergent surgeries, and lastly would be things like I do that are just more elective. Complexity of surgery, obviously, taking off a mole is not going to have as high of a mortality rate as a heart transplant. And then lastly, overall surgery team skill. So, where you have your surgery does make a difference, whether it's, a level 1 trauma center or, somebody's office does make some amount of difference. So for elective surgeries, because I'm going to leave out trauma surgeries because those are just so random. It's hard to get an estimate of, what is the risk of dying if you have a gunshot and make surgery. That's so just esoteric. A lot of people, basically dead when they come in, but they still go to surgery. So that's hard to evaluate. So I'm going to kind of leave out some of the traumatic surgeries. For elective surgery, though, it is lower. So if you leave out trauma, the risk of surgery goes down to like 0.1 to 0.2%. So I want to go through some of the surgeries that carry the highest risk and kind of start at the top and go down. So the first would be any surgery related to a abdominal aortic aneurysm. So have you guys ever heard of the aorta? Does that ring a bell?
I've heard of it before,
okay.
Yeah.
So the aorta is the major blood vessel that comes out of your heart. So your heart sits here, and there's a vessel called the ascending aorta, and then it kind of goes down, and it has all these branches which supply blood to all your organs and basically keeps you alive. And as we age, the aorta in some people can almost get dilated. Specifically it's called an aneurysm, which is just a doctor word for a unusual dilation. But what happens is just like a tire that gets overinflated, as the aorta gets overinflated or stretched out, the walls get thinner and thinner and thinner and thinner. So as it gets larger, the risk of it rupturing goes up and up. And the problem is this is your main blood vessel. This is it. If this thing ruptures, you are in really, really, really bad shape. In fact, for people who have a rupture, at home, 50% of people die before they make it to the hospital. So half the people do make it to the hospital, and then they'll go in for emergent AAA repair, abdominal aortic aneurysm. And I've actually done these surgeries. I worked several shifts doing vascular surgery, and in the trauma hospital I was at, even some of our general surgeons did these. They're very hectic when it comes in and somebody has a ruptured AAA. It's just like they were shot. You have to get them in there and work really fast.
Sounds terrible.
But for those people that make it to surgery, about 40% of those people die. So that would probably be the top, a AAA repair. 40% mortality for an acute rupture. Now, if it's elective, say someone knows they have an aneurysm, but it hasn't ruptured, it's still up to 10% mortality for that, just depending on various factors, because they tend to be older patients, and they are very big surgeries that potentially have a lot of complications. And interestingly enough, there's a famous person that died from a AAA rupture, and that was Albert Einstein, the famous scientist. Yeah, I tried to find somebody noteworthy that had something.
Yeah, he's pretty noteworthy.
I figure Albert Einstein's pretty big. So next on the list would be cranial decompression. So That's kind of a generic term for any surgery where you're taking part of the skull off. And so that can be for various reasons. It could be for, a brain infection, could be for trauma. Someone, bumps their head. I said I was going to leave off trauma, but there are other reasons why someone would have a cranial decompression. But this surgery basically takes part of the skull off to alleviate pressure inside your brain. Swelling of the brain is a very, very dangerous thing because our cranium, our skull, is not expandable.
Yeah,
and so if the brain starts to swell, it immediately starts to press against your skull, and it can actually kill the brain tissue, which then makes the swelling worse, which then kills more tissue, and it's kind of a cyclical thing that can quickly result in people dying. So when people do get swelling in the brain, a decompression, cranial decompression is the surgery that they would do. I've done sort of these surgeries. I didn't do a lot of neurosurgery, but I did do cranial vault reconstruction for kids with craniosynostosis, which is where the skull doesn't unfuse correctly, or it fuses too early, and then they'll have the skulls where it's normal on one side and then misshapen. And so I worked with a really famous craniofacial surgeon when I was in my plastic surgery training, and we did a lot of those, which is a form of cranial. You're doing the surgery for cranial decompression, but without the actual swelling of the brain. And it is dangerous. He's a fantastic surgeon, but I know for a fact that there was at least one patient that died while I was there. I wasn't in on the case because it's just dangerous surgery. I mean, you're literally taking your skull off your brain, and bleeding can happen, and things can really, get out of hand quickly. But mortality rate for that's 26%. So for people who have to have a cranial decompression, 1 out of 4.
Very serious.
That's serious stuff. I mean, you don't want to have to have your skull taken off. So moving back to the aorta, so the next would be aortic dissection. So this is kind of a more unknown thing. So when you look at the aorta, if you were to cut it, in half and look, on the inside of it, there's different layers of it. Yeah. So a dissection is when the blood flow actually doesn't go through the center channel, but it gets in between the separate walls of the aorta itself. Okay. And it's almost as though it's finding a different route to push the blood. Well, what happens is when the blood goes in there, the pressure separates the walls, and then it occludes the place where the blood should go. Yeah. So these are very, very dangerous things that happen. It immediately causes people to, have all these very serious symptoms or potentially cardiac arrest. And so the surgery to fix these is a really big deal because you have to get into they normally happen high up, like on the ascending aorta. So you're having to get inside the chest. Mortality rate for that's 22%. So about a little over 1 in 5 patients who go to surgery for that die. John Ritter.
Yes.
Who was
Three's Company.
Three's Company. He died of aortic dissection. Yeah. I think I scrubbed into one of those cases. I don't have a lot of experience with those. I think maybe I was on cardiothoracic when one came through. I can't remember if it was elective or emergent, but they are pretty big surgeries.
Yeah. Sounds.
Next would be liver transplant. I've actually done a few of these. We had a really big transplant program at the place where I trained. This is probably my least favorite surgery in the world to do. You don't transplant someone's liver because they have a great liver. And so when you're trying to get the old liver out, it just sucks so bad. Like they're usually really scarred up, very difficult to get out. Then you're having to take a donor liver, put it in, hook everything back up. The longest surgery I ever scrubbed was a liver transplant. It was somewhere around 13 hours for a single surgery, which is brutal. And these do carry a lot of risk. I mean, just the fact that you're taking an organ as complex as the liver out and then putting a new one in and hooking everything back up, there's just a lot of potential.
Yeah, it's huge.
Yeah, I mean, it's you're just saying it in words, it's like, you can really do that? I mean, you can, but it does have some potential problems. And so mortality rate for that's 10%. And, it's an interesting story. One of the very first patients, I did transplant first when I was an intern. And I'll never forget this story. So a guy came in, and he was a surgeon. Okay. And he had hepatitis C that he got from a needle stick in surgery, and his liver was failing, and so he needed a liver transplant. And when he came in, he was actually in pretty good shape, because when you're in liver failure, it's not as though you're always on death's door. I mean, it can be controlled to a certain degree. Anyway, so he came in, and we had found a liver for him, so we did his transplant. And then he had what's called an acute rejection. So even though he matched up to the liver donor, his body just rejected that liver. And so when that happens, you literally have a day or two to find a new liver or they die.
Right.
So we found another liver for him, miraculously, took him back to surgery, put the new liver in, and then he rejected that one as well. And then he ended up dying, which is, I mean, it's one of those things. I mean,
like somebody in my family died of hepatitis C from...
Really?
From, they had
blood
liver...
transfusion?
Yeah, blood transfusion. Like, how do they not... Like, how is that...
Well,
how does that happen?
I mean, so there was a time in the past when they didn't necessarily scan blood for all these various things.
He was like an alcoholic and like had to like have all, he was like, his liver was just horrible.
So I mean, if you're an alcoholic and you have hepatitis C, that's like the double whammy. I mean, that's really bad.
He died like very quickly.
Like liver failure in general is bad, but if you're alcoholic where you have cirrhosis of your liver.
Yes, that's what he was getting blood transfusions for, I guess.
Oh, okay. Well, he probably could have got from the blood transfusion.
Yeah.
Anyway, so liver transplant, serious stuff. Mickey Mantle died after a liver transplant. He had liver failure, and he did get a transplant. I think he died like a month later. So, huh?
I said, oh.
Yeah.
Yeah.
I actually met Mickey Mantle a long time ago, back in the 90s. I was a big, huh?
I said, interesting.
He was I was really into baseball when I was a kid, and he obviously had retired, but he would do these baseball card shows and sign autographs.
That's cool.
And I had a friend who would take me to the baseball card shows, and so I got to meet Mickey Mantle and got his autograph. He was a cool dude. Lung resections. So people that get a lung resection, there's various reasons. Cancer is generally the big one. If you have a tumor, you want to resect that if it's even possible. So lung resection can carry a 5 to 10% mortality rate, which is pretty high. That does depend on how much of the lung you're taking out. Some people will get just a part of their lung taken out, like a small part. Okay. Other people need the entire thing taken out, so that's why there's that.
Can you live with one lung?
You can, yeah.
Oh.
You can, yeah. So anyway, that's another big one. I mean, you're getting inside the chest. If you get infection post-op, I mean, that's very serious. You can get sepsis really fast, so that's another really, really big surgery. Another resection is following that one is colon resection, 5% mortality rate. Now, that's a little bit skewing because a lot of people get their colons out and not 1 out of 20 people die from a colon resection. But what this does include is people who've had some sort of perforation of their colon. So there's some disease processes where the colon will pop inside of you and it dumps all that stool in your body and then you get super, super sick and then they come in and they do a colon resection. Those people are much more likely to die than if you say, you go to colonoscopy and you got a tumor and they got to cut it out. You're probably going to be okay from that, at least from the surgery. Another resection, pancreatic resection. This is an interesting one. This is a procedure called the Whipple. So if you get pancreatic cancer, there's a procedure that takes out the pancreas, part of the small bowel, and part of the stomach, and then hooks everything back up. They call it a Whipple procedure. I did a bunch of those in training because we had a couple guys that were really known for doing them. Very tedious surgeries. I really didn't like doing them. In fact, I was talking to my general surgery friends just this week about them, and we both hated doing them when we were there.
Sounds...
Yeah, it's very tedious.
Critical.
And, yeah, just, I don't know.
Detailed.
Yeah. So 3% mortality rate with that. So we're getting lesser, but still 3% mortality rate is pretty high. I mean, that's not insignificant. So next is a straight up heart bypass, CABG. Yeah. They call it coronary artery bypass grafting. They call them CABGs, CABG for short. 2.5% mortality rate. So that's what, 1 out of 25, I guess? Yeah, think about it. So yeah, I mean, for the obvious reasons, when you're working on the heart, there's always the risk of something happening. The graft that you do can go bad. You get an infection.
That happened to my friend's dad. She had,
really?
Or her dad, it got an infection, and he was literally getting nurses coming to their house. It was like his chest was open still.
Oh, right. So
and
actually,
they were cleaning it.
But did he do okay?
No, he's fine. He's alive.
Okay, good.
Yeah.
I actually do those surgeries, so that would be a sternal dehiscence after CABG or any sternotomy procedure. So a lot of times plastic surgeons will come in to fix those, and also wound care doctors, which I'm not really a wound care doctor. I'm just a plastic surgeon that does wound care, but I see a lot of patients with sternal dehiscences after CABG. Unfortunately, it's just one of those things where when you cut open the chest and you sew it back together, it doesn't always heal great.
Yeah, it just wasn't healing.
Yeah.
I just remember like whenever we were kids playing at our house, we'd be like, oh, we gotta leave because we don't want to see.
Right. Yeah.
Because he would literally just like sit in the living room, like sitting on his recliner with this nurse, like cleaning his stuff. I
have a crazy video of a surgery that I did. I'll bring it next week. It was a patient I got consulted on, and it was a patient whose sternum dehisced like so much that you could literally see the heart beating in the bottom of the wound. It was crazy, and so I fixed it. It's a really cool. I'll have to. It's a video. It's maybe like a minute long.
Is it as gross as that other video you showed us? With like it looked like there was a person inside of.
Yeah, probably so. Yeah.
Oh, very nice.
Yeah, I posted that, and I really thought that thing would go wild, and I don't know if it's getting throttled or what, but really, I don't know. People were not interested in that.
You posted it like on social media?
Oh yeah, absolutely.
When?
This past week.
I didn't see it. It didn't pop up on my feed, so it must not be getting.
Maybe we just posted it to YouTube Short as a test. I thought we posted it to Insta too. I wonder if it's getting throttled because it's like medical. I don't know. I can never understand social media.
Me either.
It's just crazy. Lastly, I put on there just as a what's it called? What's it called when it's not, you don't get an award, but you're honorable mention.
Yeah. Oh, okay.
Honorable mention. I put Brazilian butt lift on there.
Oh.
It's much lower.
We hate it.
Huh?
I said we hate it.
I hate Brazilian butt lift. 0.02 to 0.03% mortality rate, which actually for elective plastic surgery is very high.
Yes.
Like that's
that's
1 in 3 to 5,000.
And then it goes up if you go to Florida to get it.
Speaking of which, I had two patients this week come to my office that went to Mexico to get tummy tucks and were having bad complications.
Yikes.
In fact, the first one came, and then my next office day, my nurse was like, okay, we got a patient with, went to tummy tuck, went to Mexico to get a tummy tuck. I was like, we just saw that patient. She's like, no, this is another one. I had another one. 2 in a week. Pretty crazy, right?
It's insane.
Wild stuff.
I would never do that.
Let me know what you think about the most dangerous surgeries out there. I did leave out things like gunshots and crazy car wrecks just because those are so hard to kind of quantify. But if you have any questions about those surgeries, please leave me a comment. I'd love to know what you think. So.
Yes.
All right. Moving on to a very, very unusual topic that I saw, and the reason I kind of did this topic is I saw a story about a person. I'm going to tell the story about this girl named Jewel Shuping. Have you guys ever heard of her name? I never heard of her.
Her name's Jewel Shuping.
Shuping. Shuping.
Okay.
I've not.
I'd never heard of her.
No, I've never heard of it.
I saw a story about this girl. There was a news article, and this didn't just happen. It's been a little bit. So this girl was born completely healthy, but ever since she was a very little girl, she dreamed of being blind. She wanted to be blind. When she was a teenager, she would walk with a white cane. And by the time she was 20, she became fluent in Braille, the blind language. And then at 21, she found a psychologist who agreed to help her blind herself. And she poured Drano into her eyes and then waited to go to the hospital as long as she could. And it blinded her. She went permanently blind.
She found a psychologist?
Allegedly. This is allegedly. She says, I looked it up and it says she never named who helped her.
Well, her psychologist needs to go see a psychologist.
Yeah, I feel like that person needs to probably face some prison time myself, but I digress on that.
That is horrible.
So she did go blind, and her family disowned her. They did want nothing more to do with her. But she says that she now is so very happy because she feels like this is the way that she was supposed to be born, and she wasn't, and now she's blind. So what she has is actually a disorder known as body integrity identity disorder.
Okay.
And it is extremely rare. That's actually her. That's Jewel Shuping right there. After she blinded herself and she got her cane. So this is a very, very rare disorder. It's hard to quantify exactly how many people have this because it is so rare, but it's definitely way less than 0.1%. I mean, we're talking like 1 in tens or hundreds of thousands. And it is characterized by when an able-bodied person, so just normal, healthy person, has an overwhelming desire to be disabled. And that could be in the form of blindness like her, be an amputee, like lose an arm or leg, or be paralyzed.
Like,
and
I feel like that's like, I remember when I was a kid, my dad had a pair of, what are those things where you put them under your armpits?
Crutches?
Crutches. And I used to be like, oh, I want to go play on those.
I don't
That'd
think
be
that
cool
qualifies.
to use them. I know, but like, No, I don't think I ever had that disorder, but I could see how, like, if you started, like,
Down
if
the
you
wrong
had
path.
that, like, that encouragement to do, like, yeah, you should play on crutches. Like,
Maybe.
you know, like,
I could
maybe
see-
her family
maybe.
was, like, encouraging. Like, you know, you're a kid with an imagination, and, like,
Have you guys ever heard of this, though, this body integrity identity disorder?
No.
Had you heard of it, Charles?
No, I haven't. I've not heard of it.
I have to say, I went through medical school and residency training, and I had never heard of this. I didn't know this was a real thing. And to be fair, maybe it's only being recognized as a real thing recently. But I don't remember learning about this in med school or residency. I can't say I've ever seen a patient that has it. So, I mean, this is not a common thing. I read this article, and I'd seen that, you know where I'd seen this term thrown around is when people are talking about people with gender dysphoria that want to have transition. And some people would say, oh, well, it's similar to body integrity identity. I had to go look it up.
I mean, that's what I thought about.
Yeah, I had
But
to-
except they're not trying to disable themselves.
Right, yeah. We can talk about that in a second. But yeah, I had to go look it up. I was like, wait, body integrity what? And then I was like, oh, that's a thing?
I don't know. That just seems so weird. Like, why would you want to impede your life to live?
I mean, it's a great question. The most common thing that people, it is much more common in men. I don't know if I mentioned that. 80% are men, 20% women. So Jewel was kind of in the minority there. The most common thing that people want is an amputation, like they want to lose a limb, like an arm or a leg. Second is they want to be paralyzed, which that just blows my mind. Anyone would, I mean, I guess all of it blows my mind that somebody would want to purposely cut off their own arm. But the fact that somebody would want to be paralyzed, that seems like literally the worst thing in the world. I think I would rather be dead than be paralyzed personally. I don't know how you guys feel.
That's like the reverse of being like, I wish I had superpowers.
I know, right? Yes, you're so right. It's like
It's
there's
like,
people that want to
what?
be superheroes and people that I guess want the opposite, like less
Yeah, that is
power.
so strange.
Yeah, it's hard to wrap your head around. So of the people who have this disorder, almost 90% have thought about doing their own body modification. So a lot of
I wonder if they have they're like more suicidal. Because they're putting their lives at risk.
That is a good question. I want to say when I looked this up, I do think that there was a higher risk of things of other anxiety or suicidal type disorders. I think
like
you're
if
correct
they're
on that.
willing to go that far, what else?
Yeah, right, exactly. So of the patients that have this, 1/3 of them will go to a doctor to try and get the doctor to do whatever it is they want, whether it be amputate something, paralysis or whatever. I can only imagine, I would assume my office people would just block that. I would never hear about it because my office people are like, no, he's not doing that, click. I've never had anybody personally ask me to do anything like that. Another 1/3 actually attempt the modification themselves. So a third of
Yeah,
people.
because most doctors are sane.
Yeah,
would
they're
not do
not
that.
going to do it. No doctor's going to do that. So yeah, 1/3 of the people actually attempt to do it themselves, like Jewel, did to blind herself. As we said, the people that have it do sometimes compare themselves to patients who are trans that want gender transition. I don't know. I don't really buy that. And you hit the nail on the head. I mean,
It's like it might go down the same path, but it diverts.
yeah, it's a huge difference.
Yeah,
because, I mean,
it's like you might walk down. It has the same I want to be different,
right.
but I don't want to make it to where I can't live my life.
Exactly. I mean,
They're
that's
not doing that.
Because I
trans
don't think
people.
anyone would agree that someone who has gender transition is disabled. They're just
No, they just want to
regular
be
able
different.
people that are a different gender
Yeah.
after surgery. So to me, it's not the same. So of course, there's this big talk about ethics when you're talking about, and I'm not sure who's actually talking about this because I said I didn't even know this thing really existed. But when you read about it, there's people. Oh, there's this discussion about the ethics. Like, who's discussing this? But
Who's having conversations?
the discussion about it is by the ethics of body autonomy, right?
Yeah.
A person wants to do something to their body, and should they have the right to do that?
But isn't it against the law to commit suicide?
Is it? I
Like
don't
you
know.
could- like
I
if
think
you,
it
like,
depends on the
attempt-
state.
I don't know.
That's a big question you just asked. I'm not sure. I
I'm
have
pretty sure it is. That's why you can be arrested for
attempted suicide.
Yeah, for
Wouldn't
if
they
you
just
called,
put you in a kind of a mental hold? Or
Yeah,
something?
they do that. But I'm saying
I
they
don't
can
think they charge you with a crime though, do they?
I don't know. But if you tell a bunch of people one day I'm gonna commit suicide,
Oh, yeah, they're gonna commit
and
you.
and then
Yeah.
somebody's like, hey, this dude's,
This
being
person needs
cray.
help. So with
Yeah.
body autonomy, I mean, when you bring up the question of that in a person with body integrity identity disorder, the medical consensus is that they don't have the insight to the disease that they have. So therefore, they lack the autonomy to make the decision.
Yeah.
And I guess that's just the doctor way of saying we're not going to do this.
Well, it goes against, like I said, like your
do no
ability to
harm.
live.
Yeah, I mean, I guess the whole doctor mantra is do no harm, right?
Well, I mean, yeah, but it goes against like a human nature instinct.
To disable someone. I mean, and honestly, I have huge ethics issues with making someone disabled so that they're dependent on other people.
Yeah, but maybe that's what they want.
I mean, that is a good point. I don't know. That seems like a very big step.
They want people to
Support
have to
them.
care about them, not have to care, but like have to take care of them.
Well, currently the recommendation is not to indulge in their desire for body modification. There is therapy for this. Cognitive behavioral therapy is apparently pretty effective in treating people with body integrity identity disorder. And then also the SSRIs like Zoloft and Prozac have been shown to be helpful. So.
Well, that's good. That's scary.
It's crazy stuff. I honestly, until the past year, I didn't know this was a thing. I don't know. I'm not sure I believe the statistics to say 1 out of 1,000. I think it's like 1 out of 1,000,000 maybe. I've never seen anyone or heard anyone in my 20 years of doing medicine that has this.
Yeah.
So I don't know.
Intense.
Crazy stuff. All right,
Yeah.
Sarah, you're gonna.
Anyways, yeah. Fashion.
You're gonna get us up to speed on fashion. So we moved from amputating our own limbs to
buying clothes.
buying clothes. I think it's a good transition.
Yeah.
And
sure,
there's
why
like a
not?
test or something.
Yeah, I'm giving you.
Travis, are you ready? Like, is there right answers or no right answers?
I mean, there's a right answer.
Oh,
but
there's a right
all
answer.
of them are cute. All of the things are cute. So
All right.
yeah, it's a this or that summer fashion quiz.
All right, I'm gonna pull mine up because I saved my pictures because I don't know if I can see it all the way over there on the monitor. So
Yeah.
I want to make sure I give a good.
I thought
answer.
I'd be cute, and I made that. Thought it was cute.
You made that yourself?
Yeah,
That's really nice. That's better than the ones I make. Mine are really kind of, I don't know, utilitarian.
I'm artistic.
You are artistic. I'm gonna have you make more.
Okay, so first one, it's this or that.
Now-
Which summer dress is on trend right now for summer?
Oh, so we're trying to say which one's on trend?
Now.
Oh.
Summer fashion.
Okay.
Like right now. Both of them
Travis,
are
you wanna go
cute
first?
dresses.
You go
Yeah,
first.
I'll say B.
You say B.
Just because I like B better.
Well, I don't want to just say what Travis says, so I was kind of toss up. I'm gonna say.
Which is it?
I got a feeling.
You know what? I'm gonna have to. I'm gonna say B because I'm gonna say it's off the shoulder, and that's the trend.
I
Wait,
got
I'm
a
gonna
feeling
just
it's
pick out the
A
trend.
because the dress with the tennis shoes, it kind of like. I
Wait,
see
you're
it
changing
better
your
like-
answer now?
No. I still stick with B.
Oh, you're sticking with B.
It's A.
Yeah.
It is A. Dang,
Yeah,
we're both wrong.
blue
Okay, so
and white floral dresses are very in style right now.
Oh wow.
Not just like that style, but just blue and white. So like having a white dress with blue floral print, which is it's a great dress because I think right now when you think of summer, what do you think of? Like in
Flowers.
America, anyways.
like here,
Heat?
Texas, heat, melting.
Well, I think of 4th of July. Like
Oh,
I
right.
think of like barbecues. I
Yeah.
think of like all that stuff.
True.
And red, white, and blue. Like just basic Americana. Like thinking.
I
like
will
that.
tell you, of the two, I prefer A. I was trying to outthink myself.
Yeah.
And I outthought myself into the wrong answer because I do prefer A.
Yeah.
I like that very kind of basic, kind of like a very base color with like a pastel kind of flower.
Just
I
something
that's
simple.
appealing to me. Yeah, I do like it.
Yeah, like that dress. The other dress was cute, but that's more
It
like
is.
something you'd wear to like.
Vacation.
Yeah.
I still
The
liked
other,
it, though.
yeah, it's super
I do like
cute.
it. I like A better.
Yeah.
Okay. All right.
Okay, next
I'm gonna
one.
go first.
This
I'll go
or
first.
that.
Okay, this or that.
A or
Okay,
B.
so we got on the A, we got a skirt with a top of the over
Focus
jacket.
on what's similar about them, and then you'll figure out what is the trend that I'm trying to get.
So the trend is for like halter tops.
No, it's skirts. So which skirt
Oh.
is like?
The
Which
tops are
skirt?
similar. The tops
They are similar.
Okay, so which one is more? Well, I would say.
I
I'm
mean,
gonna
they're
say
both
B.
cute, but what's on trend right now?
B.
Yeah, my answer was gonna be B.
Yeah, it's true. Maxi skirts.
Maxi skirts.
Yeah, they're super on trend right now.
I do like it.
Yeah.
I think it looks great. So, all right, so we weren't trending about the top part.
Yeah, you got one so far. We're moving.
All right, we're
We're
on the right-
doing it.
All
All
right,
right,
Travis,
this
what do you
or
got?
that. Which one? So this is on the tops. We've got a crochet top and a polo, a cropped polo. Which one is in style right now?
So which one is in style now? I
Yes.
will say this one is tougher. I'll say A.
I'm gonna say B. I'm gonna say crop knit polos are in style.
It's A.
Oh, good job, Trellis.
Right on.
Crochet.
Crochet
But really
is in?
anything crochet is in right now.
Really?
Like that little set that chick was wearing, it was a maxi skirt. And it was a crochet. Well, you can't see it. I cropped it out.
Oh, I see.
Because I was focusing on the shirt.
I
But
gotcha.
yeah, anything crochet, like crochet set, crochet dress, like
Yeah.
anything like that.
Okay.
It's very
I like
in
it.
style.
All right.
Okay.
Wait. I'm sorry. With the crochet, can you can you see through that?
You can on some stuff. So obviously you should wear something underneath it. But like
Right.
they have crochet sets that are like pants, and you can wear like your swimsuit bottom underneath it with like the top.
Oh,
And
so
then
like a
there's dresses.
sarong
Yeah, and then
type
there's dresses that are crochet.
Okay.
Like I have a crochet. I have crochet tops too, but like I don't just like.
So I'm gonna
Yeah, it makes sense.
totally go off in the weeds here.
Okay.
When you were out at Scarborough Fair a few weeks ago, did you see the chainmail dress?
No.
The chainmail dress.
Yeah, it was. You know what chainmail is, right? It was an armor used 1,000 years ago, and it's made up of little rings of metal.
Okay, yeah. So, but I thought that was like it's like the under part of an armor.
It
suit.
is,
Right,
yeah, it's chainmail. Yeah, so they have a chainmail dress out there at Scarborough Fair.
Is it for men or is it for girls?
No, it's for a girl.
Oh.
I keep trying to get
That's
my wife
in
to buy
style.
it. Dude, it is sick. I don't know if I've ever taken a picture of it, but the style of it's actually pretty cool.
Actually, I think I know what you're talking about because I literally remember walking.
It's right up there at the front to the left.
No, now I remember it.
And it's kind of a longer dress, but it's asymmetric. It's got like a single strap on one side, and then it's got like a big slit.
Yeah.
It's the coolest dress ever, and it's made of chainmail. I mean, I think it probably weighs 30 pounds, but it's really sick.
It's in style to wear stuff like that right now.
I know. I keep
sure.
telling my wife she should get it. She's like, I'm not wearing because it's kind of see-through.
Metallics.
What,
Yeah.
You know, it's because it's chainmail, so it's see-through. I don't know what you'd wear underneath it, but I think it looks
Something.
awesome. I'm just gonna buy it for her one day. I'm gonna go out there and buy
There
it.
we go.
You got to take her somewhere to wear it. I guess you could just tell her to wear it at your house. But
I mean, if you have a
don't need
chainmail
to
dress,
get
I
into
think you
that.
wear
We
that
don't need to
dress
know.
anywhere you go, because that thing is like gonna be a statement piece, right?
it would.
All right, sorry, I didn't mean to derail your conversation with
No.
chainmail.
It's fine. So this or that. So obviously this is about shorts. So which pair of shorts is in style right now? We've got like a light pair, and then we've got a dark pair.
I'm gonna say, oh, is it my turn?
I mean, either of y'all can go.
I'm gonna say B, frayed bottom, stonewash shorts are in style.
Yeah, I'm gonna say B.
That is correct.
Is that the right
Absolutely.
Is that the right
Yeah.
reason? Yeah, you know how I know that?
What?
Because I took my daughter to buy some shorts the other day, and I was like, oh dang, everything's coming back that I love. Because
Yeah.
I love stuff like that. I think it looks really good.
The lighter pair, yeah. That's like my favorite color.
Yeah, those
Obviously,
things
I'm wearing a pair of light jeans right now.
I like
like all I wear.
that stonewash look. And then my daughter tries to argue with me. She's like, nobody wears that color. I'm like, I think it's coming back. It's stonewash. It's,
Yeah.
you know. She's like, I just like darker jeans. Like, well, I get that, but these ones are kind of in style. I mean, I hate, when my 12-year-old argues fashion with me, but it does happen pretty commonly, and you know her.
I do know her, yes.
Okay.
This or that, we've got some cargo pants, and then we've got some super flares.
Okay, this one
Which
is
one's in style?
this one is like a little tougher because I see the style for both, but I see the cargo pants more so like on dudes, like the oversized cargo pants on guys. But I see guys wearing the flare like bottoms as well, or bell bottoms, whatever you would call
Guys be wearing that stuff.
them.
now.
Yeah, they do.
He just gave me a weird look. He's like, what you talking?
So, Travis, which one are you going to go with?
Yeah, what are we doing?
So I would say B.
I'm going to go with B too. I see a lot of those flare bottoms. I think they're super sick. They should be in style if they're not.
Right.
Well, they're both in style, but A
It is
more
A?
in
It's
style.
A.
So,
See,
girls wearing cargo pants is in now?
I have a pair. I have a pair of Dickies, cargo pants.
Is it jean material? No.
Are they
I
like
think it's kind of jean-ish.
Yeah.
They're orange. I've worn them on here before.
are they oversized like cargo pants? Like do they have to be like
So,
baggy?
You can do
bigger?
either or, but I think right now it's in style to have them like high rise and fitted, but in your waist and your butt area, but have it more straight fit on your legs.
So I'm just going to tell you, I love cargo pants. I love cargo shorts. When that crap went out of style 20 years ago, I refused to accept it, and I've kept wearing cargo stuff this entire time because I just like them. It's
Yeah.
so utilitarian to have those pockets to put your phone
gotta have
in,
your
your
pockets.
keys. you know, whatever it is you have.
Yeah.
It's so convenient. I have cargo pants on
Yeah.
now, and like that, I will not get rid of them.
I love cargo pants.
Yeah.
In fact, my
They're in
daughter
style
again was giving
now.
me grief about wearing cargo pants the other day, and I was like, well,
Now
I
you
didn't know
can
they
tell
were.
her that Sarah said they're in style.
Well, I'm gonna tell her when next time I see her. She's at camp right now. When I pick her up, I'm gonna be like, Sarah told me that cargos are in style, not only for
Absolutely.
men but for women, right?
Yeah.
So you need to owe
Absolutely.
me an apology. And so you can get this stuff at your store.
Yeah, so like right now, what I literally have like in my cart to buy for the new collection at my store is called Free to Be, and it's just like very Americana. So we've got a crochet top, we've got this really cute little blue romper, and then those white cargo looking jeans that we've got
you have
there.
men's stuff too? I'm gonna come by. I bought some stuff from your place, and I do like it. There's a shirt I bought there. I wear it literally like, all the time.
Yeah.
So can people buy this stuff online, or they have to go to the store?
Yes, this stuff
Oh, they
isn't
can.
online
Okay.
yet, but this is
Alright.
just coming soon.
Okay,
Yeah,
cool.
so I thought it was really cool because whenever I was doing this little segment, I had already thought about, I'd already gone shopping for my store, and so I just and I watch a lot of YouTube videos about like fashion trends and
Nice.
stuff. So it was like, oh, I do know what I'm doing.
I think you know what you're doing. I
Thanks.
always ask you about stuff like this because you are the expert. So.
Yes.
Well, thank you so much, Sarah. I love when you do segments. I actually really like fashion, so I'm all about these things, and I feel like I get smarter from reading them. And now I'm going to go
Yeah.
home and I'm going to school my daughter on how she was wrong when she told me cargo was
I know.
out of
She
style.
says she always likes my outfit, so
Yeah, I'm
hopefully
going to tell
when
her.
you
She
tell
does
her.
look up to you, so I'm going to tell her. So.
Oh.
Well, thank you so much for getting us up to speed on summer fashion.
Yeah,
Cool.
you're welcome.
Well, everybody, I think that's all the time we have today. Please leave us a comment. Let us know what you want us to talk about on the next episode of Nip Talk.